wants to look like a big fat pig.
He says big fat pig.
Well, put that turkey leg down and hide the Twinkies. Part of the health care bill could pay community organizers to actually show up at your house to monitor what you eat. Okay, Jonathan, this might literally be the fat police.
Yeah, and that's the problem, Terry. I mean, when you make health public, all of a sudden, your body, your health really becomes public property. So yes, whether you eat the turkey leg or the alfalfa sprouts, do you smoke, do you get high, do you exercise, all of a sudden this becomes the public interest. And essentially you're no longer free to live your own life. Every move you make is either influenced or controlled by the state. It's the road to serfdom.
Road to serfdom. Steve, but if the government's paying for all this health care, then maybe somebody should monitor whether you're living a healthy lifestyle or not.
Regardless of health care reform, no, you're absolutely right. Regardless of health care reform, we're all paying, who have health care or who pay taxes, we're all paying for people who are overweight. To the tune of, the cost of being, having diabetes, the cost of heart disease is over $500 billion a year. We're all paying that now. I think that's something that, should be looked at. And, and that's even forgetting having compassion for people who have a horrible quality of life.
How am I paying for your diabetes?
Because about $1 in $10 spent in healthcare is straight up obesity related. And whether you have any government healthcare or not, it's passed on through the private healthcare.
So let the fat people pay for their own obesity.
Exactly. Why is the fat police? If you could charge extra if you're overweight, like you're a bad driver, which is exactly what they should do. Unfortunately, there's all these problems with doing that. That would be great. So you need the government, because you can't sue the government for discrimination. That is easily, at least. That is why we need to do this. These people need to pay their way.
But the point is that there is a productivity issue as well, and that affects the entire economy. If these people are obese, they tend to get sick more. That means it affects. They can't make it to work. Things don't get made. Things like that. I mean, look, it's a stretch, but to the point that there should be some sort of surcharge, I don't think that's out of the realm of craziness.
Well, we have an average 32-hour work week, so I guess the productivity thing isn't a problem right now. Wayne, where do you come down on this?
Well, I don't think this is the question. You all are missing the question. The problem with this particular bill is that it is allocating certain dollars to community-related organizations. There is no definition of how they're going to get these grants. There's no definition of their powers to go in to measure you and weigh you and do all of that. The whole bill is a conglomerate of stupidity, if you really want to know. This is another thing of where the Congress has hatched something in a broad generality, and the details are not to be spelled out, so nobody knows. They even asked Kennedy about it. Yeah. He refused to answer. They asked Chris Dodd about it. He said, I can't explain it. Well, if the Congress who legislates this can't explain it, what the hell are we doing voting for?
There's no legislation. Right. But that's the whole point. There is no legislation. Your health is your right. Your health is your responsibility. And if you want to eat, hot wings and the beers all day long, I think you should have every right to do it. And for a community organization, I mean, essentially, this is like a healthcare acorn coming to your house and telling you that your BMI is 20% over.
But John, it's not your right to make other people pay your health care. But Wayne is right. The problem is the idea. Well, the idea is sound. Make people pay their way. Of course, the way the government's going about it doesn't make any sense, which Wayne is exactly right about that. It should be no more complicated than you have to pay a lot more if you're heavy. Why can't we have a healthcare system like that?
But the problem is people coming into your house. You want someone to come into your house whether you eat arugula
That's the stupid part of the bill. That goes under this big stupidity clause that Wayne said. But there should be.
We have an obesity epidemic.
But you don't want someone showing up at your front door. I get that. But there should be some sort of standard, some sort of even little chart that if your weight gets above a certain extreme level, you potentially should have to pay more because you are unfortunately hurting the rest of us.
Remember the last time the government gave advice on nutrition? We got the food pyramid with 8 servings of carbohydrate at the bottom.
Jonathan, how about the time they stopped cigarette smoking, advertising there's less healthcare costs today because of government involvement in cigarette smoking, making a certain minimum age, limiting advertising, taking cigarette machines away from children. Those things didn't lower healthcare costs for private insurers as well as you because somebody else is smoking, not paying their way. There's cases where the government can go in here and lower healthcare costs.
Wayne, we're going to give you the last word.
Well, no, as I said, I think this is dumb legislation again. This is somebody where they're trying to legislate something where the devil is in the details. You cannot quantify or give criteria to how people should behave, and you can't ask them to do that. It's just outrageous. I mean, it's once again where the government's interfering in something that they shouldn't be into.
Okay. Voice of wisdom as always. Thanks, Wayne. And coming up, what's more important to Americans during this recession, saving a few bucks or saving your sex life? Surprising results next.